Arthritis in the shoulder joint, particularly osteoarthritis, results from cartilage wear over time. This can cause intense pain. Treatment varies, including physical therapy, medications, and sometimes surgery. Bone spurs, or osteophytes, are extra bone growths that can cause shoulder pain by pinching tendons. Treatment involves rest, physical therapy, and possibly medications or injections to reduce inflammation. A broken shoulder bone, often from falls or sports injuries, leads to pain and limited motion. Treatment ranges from rest and physical therapy to surgery, depending on fracture severity. Shoulder dislocation occurs when the humerus is displaced from its socket. Treatment includes rest, ice, and physical therapy. Medications may be prescribed to manage pain and inflammation. Shoulder separation involves the collarbone detaching from the shoulder blade. Treatment typically includes rest, ice, and NSAIDs to reduce inflammation, tailored to injury severity. Nerve injuries and rotator cuff tears cause shoulder pain and limited motion. Treatment includes physical therapy, medications, and possibly surgery for severe cases to restore function. Prevent shoulder pain with strengthening exercises, good posture, and flexibility routines. Treatment may involve physical therapy, medications, or surgery, depending on the cause. Rosier MD in Mansfield, Texas, offers comprehensive shoulder pain treatment. Their team of orthopedic surgeons and physical therapists provides personalized care, including surgery, therapy, and lifestyle counseling.